In today's video, we're going over reflex testing for lower extremity. So reflex testing is one of the ways we can help to diagnose lumbar radiculopathy from a potential disc herniation, right? Now, this is part of a battery of tests you can use to help to rule in the condition or rule it out. The other piece is that we can use these as a way to figure out which level you have an injury. The problem with these tests is that they don't have a great sensitivity or specificity. It's not a perfect science. Tao et al. In 2017 found that there's a sensitivity of these tests of 0.13 to 0.67, so not great for ruling out conditions. They also found a specificity of 0.6 to 0.93, so it's actually decent for ruling in this pathology. So what we're on the lookout for is going to be diminished or absence of reflex, right? And we can assess at a myotomal level just like we would with our strength testing. If we have a reduction in patellar reflexes, that's a sign that the L2, L3, or L3, L4 level is injured. And if you have a reduction in the Achilles reflex, that's a sign the L5, S1 level is injured, right? In order to perform reflex testing, it's pretty simple. We have the kneecap here, your patella. We keep going down, eventually get to a bony prominence, your tib tuberosity. Between the two, you have the patellar tendon. You take your reflex hammer, just like this. Nice soft tap here. See that leg kick out? There's your reflex. Do the same on the other side. Go ahead and relax for me, and then a little tap. Very good. Ooh, big reflex on this side. But if you have diminished reflex on one side with associated symptoms like we talked about before, that's a sign this person might be dealing with lumbar radiculopathy. In order to assess L5, S1, we can look at the Achilles tendon reflex. So let's have you kick off that shoe right here. All right. The way I like to do this, I'm going to try to do it from a better angle for you, is I like to have my hand on the foot here, just relaxing as best you can. And then I'm going to palpate the calcaneus from the back, and I go up. The first thing that's soft, that's going to be the Achilles tendon, and obviously if you go higher, that's on the calf, but I want to be right in the tendon. From here, relax this leg. I'll just give a nice little tap on the Achilles tendon in the back. Not getting a whole lot. There we go. And you can assess and feel the reflex here. And then you do the same thing on the other side. So hold on to this, and then a little tap. Good. Yep, and there was a good reflex there. So if it's a diminished or absence of reflex, that's a sign that you have a lumbar radiculopathy. So now you know how to reflex test your patients. We still need a little bit more knowledge to have a nice thorough diagnosis for your patients that have lumbar radiculopathy or associated disc pathology. I have a video for you. It's right there in the corner. I want you to click on that, and I'll go A through Z on how to diagnose this condition fully. I'll see you on that video.